All right. Hi, all. Let's start with introductions.
Good morning. My name is Shantara Carter, and I am a teacher with Clayton County Public School System, and I have a niece and three nephews.
My name is Dr. David Montgomery. I'm a practicing cardiologist here in Atlanta. I have two wonderful girls, 6 and 11 years old, in private schools.
My name is Nikisha Watley Leon. I'm a clinical psychotherapist at Northside Hospital, and I also have a 22-month-old son that normally would be in traditional daycare.
Good morning. My name is Dr. Sharita Howard. I'm a U.S. federal attorney and CPA here in Atlanta. I am the mother of two wonderful daughters, one 5 and one 16 years old. They are both students at Atlanta Public School.
And you are a working mom. You're outside of the house, right?
Yes, quite a lot.
Okay. It's a juggle for all of us. And let me just say that I'm the proud mother of a 16-year-old daughter who is growing tired and weary of being at home. So I thank you all for joining me. We have quite an esteemed panel. So let's get right to it. If you all had the decision today, and I know for this entire panel, all the school districts have decided to go virtual to do digital learning in a few weeks, except for Nikisha, whose son is in daycare or was in daycare, and also for Shantara, who is supporting her nieces and her nephews. But if you all had this decision to make today, let's say these districts did not take this decision out of your hands, are you comfortable? Would you be comfortable sending your kids back to school in this case? Let's begin with you, Shantara, supporting your niece and your nephews.
Thank you. No, I would not be comfortable at this particular time in sending my niece and nephew back to the traditional setting due to the fact of the high number of COVID cases. And I recently just battled COVID and in recovery mode for COVID-19. I think virtual learning is the best option, and I think it's the safest option. And I do not think that the quality of instruction will be any less in a virtual environment.
And you feel that way as a teacher as well?
As a teacher as well, I've been teaching virtual instruction since March, and I also taught it over the summer. And the students, the standards are the same, the curriculum is the same, and I did everything that I normally do in a traditional classroom. I did it here in my living room. I teach math and science, so my kitchen became a science lab. And so we always say, let's take learning beyond the walls and beyond the classroom. And so as a classroom teacher, I was able to make those connections right here at home and in the living rooms of the students that I serve.
Dr. Dave, how about you? Would you be comfortable sending your kids back to school if that decision were in your hands today?
Yeah, to your point, some of the school districts have made the decision for us, but I would be extremely uncomfortable and mainly based on a couple of things. One of them is this virus is truly novel. We do not know how it's going to perform in adults, let alone in children or adolescents whom we've almost not tested at all. Think about it. In order to really know how this thing is going to behave, we've got to test it. I've asked my friends, I've asked my staff, I said, how many of you know any adolescents or children that have been tested for COVID-19? And none of them said yes. We have an example of where when you have a concerted effort to test children, the numbers are going up. Florida, 11,000, one report says, 11,000 adolescents tested positive. It doesn't mean necessarily that they're going to do poorly, but the point is, if you don't test those children, then you don't know. So all of the statistics and numbers about how children are doing are spurious at best, are putative at best, are models at best. Models and spurious are not enough for my kids. Especially if the downside, although significant, I don't want to make it seem like, my wife and I are not seriously, struggling with how to do this. But I can tell you, my wife and I, as every other person on this panel and every other parent that's going to be listening to this, would not want to learn the hard way that they made the wrong decision. So until we have some real data, I'm objective, although I'm subjective about my girls, right? Right, that's my heart. I'm objective about this. Show me the real data. Show me that you've tested and that you've retested before I'm going to go ahead and send my kids.
And your information, your assessment of all of this, I take really seriously, Dr. Dave, because you are a doctor, you are a cardiologist. You're one of the first doctors I saw say on the news, even before they took this decision out of our hands, that you would not be sending your kids back to school. In fact, you would be waiting until there's a vaccine, right?
That's exactly right. And it was based really upon some of the anecdotal evidence that we had. One of the ones that I said on air was, there was a camp in Missouri that did all of these things to try to keep the kids safe. I mean, some fantastic things that would make us all feel great about sending our kids to camp. And it turns out that many of those kids became ill and passed it on. Some of the staff and counselors got ill. And then we have examples of other countries. Let's think about Israel all by itself. Israel did great with this in May, had 300 deaths. They opened up the high schools and they had to close that thing down really quickly. Why? Well, because not just the spread of COVID-19 in those adolescents, but the spread of the disease to other people. Remember, this is not a silo disease. We're not going to just send our kids off, just live in a silo and come back and everything's fine. Yeah. It communicates through people. And there's no biology that I can think of that would tell me that a child's immune system would somehow not get COVID-19 and pass it along. So this idea that they don't spread it, just doesn't smack true for me when we know that children historically do worse, on both ranges of the age range, right? Children and older adults do worse with things like flu and pneumonia and viral infections. So I'm not quite there yet, neither is the data.
The concern really is those kids passing it on to their parents and grandparents. Nikisha, your 22-month-old son, you pulled out of daycare months ago. So it sounds like you would not be comfortable sending him back to daycare right now or in the future.
Yeah, that's correct. I just feel like we just don't have enough information, and we don't know the aftermath. And, I feel so conflicted with sending him to daycare when everyone else is protecting themselves. And so say like myself and his father. So why am I exposing my child to something possibly and keeping myself in? So I'm just not comfortable with it. And like the doctor was saying, he normally stays sick just being in daycare, period, and being exposed to all the different germs. And so I don't see where this will be any different. And then I also have a father that has COPD. And so I have to be really responsible in my decision making, and just making sure that we protect those that are around us. He's not around us day to day, but there are some times when we will visit in social distance. So I just would feel really guilty. So my mindset is, I try to make decisions around what will cause the least regret. And so that's what helps me from an anxiety perspective, and just making sure that I'm thinking things through and not being reactive, not being impatient with myself, and just being more flexible and just being okay with knowing I don't know when this will end, but this is the struggle right now and we will ride it out.
That's key right there, Nikisha. What will cause the least regret? And I feel like as parents, especially moms, we always have regret, right? We always feel like it's never good enough. Sharita, can you tell us what would be your decision for your girls?
Well, we're going to opt out to do mommy pods. Actually, a good friend of mine out in San Francisco introduced me to the whole concept of the mommy pods. And so it seemed like a really great idea, especially in the community that I live in, which is going to be West Midtown, which is a huge mixture of moms that are at home, moms that work, moms that actually homeschool children. And so it just seemed like a really great idea as far as structure and support for moms to be able to get together and have small groups where there could be virtual learning and kids not necessarily being left alone, at the same time having a tutor that would be available to assist in that particular learning experience.
So people are just beginning to learn more about these parenting pods, mommy pods, and you got on my Twitter page, Sharita, and shared your experience with these mommy pods. It kind of blew my world up a little bit because I'm like, okay, this sounds like a great idea. I want to know more. So can you just share more with us about this? You have a 5 and 16-year-old, and I think, those two age groups are so different. The 5-year-old just seems like a no-brainer. It sounds like you just send them off to school at someone else's home. Is that how that works?
So what's happening is the groups are capped at 10, as well the requirements are for you to be tested for COVID-19 every 2 weeks in order to stay in the pod as well. So there is a real strict component as far as making sure that you have a healthy environment. So if you're taking in groups of 10, and they're actually broken out by students who are in elementary school, students who are in middle school, and students who are in high school. So it's not a scenario where you just have them all in the same room and they're in different levels of grade. So that helps out quite a lot. There is one tutor that is there in the home. And so a lot of times it may be retired moms who were teachers who are now not teaching, obviously, that also have children. And so pretty much everything is going to be at that particular basis for the tutor, which makes it cost effective, but at the same time, making sure that the tutor is taken care of. And it's just allowing a really small group scenario where you don't have moms who do work left with no alternative on how to educate their children. And definitely, especially if you're at an age where you can't be left home.
So essentially, you're saying your audio broke up a little bit. So all of the kids go to one home. Sharita, are you there?
Yes.
So all the kids go to one home?
So 10 students at one home. Yes, 10 students at one home.
Okay, and they're there all week?
They are there all week.
Okay. Including your 5 and your 16-year-olds, you send them to the same house?
Students, no changes.
Say that again?
So the 5-year-old will go to one house and the 16-year-old will go to another house.
Okay, all right. So essentially it's one parent who's handling everything.
Either the parent is either hosting their home, but there's one tutor at every home. So if the parent is an actual teacher for that particular sector of age group, then she would be the tutor at that home. If the parent is not an educator, there will be a tutor there, and she's just hosting her home for the 10 students.
Does this require you to pay any money to the mom who's hosting the pod? Sharita, were you able to hear me?
It's not a requirement, but the way that it's been pretty much can make sure the tutor is there to be able to help educate the students.
Is there a fee? Is there a fee that parents have to pay?
I know for both of my students, it's $100 a week for my 5-year-old, and it's $150 a week for my 16-year-old.
Okay, yeah, that lines up with some other stories I'm hearing happening all across the country. It really is a great idea. I guess the question now turns to, what about those kids who are coming from low-income families, who can't afford to do the mommy pod situation, or who perhaps are not home, just working? You know, a lot of folks have jobs all day long and they're not there to be able to bring their kids to these mommy pods. Anyone else have any other suggestions on perhaps some things we learned in the spring on what we can do to support our kids? And anybody, feel free to jump in here.
As a teacher, I supported my students, and we're Title I school district with low income poverty area. And I supported my students by being that additional support for the parents as well. So the students that I had in my class, the parents often had to work, and they weren't home during the time that I was teaching my reading and math. And so I spoke with the parents and made sure it was okay for me to do the wake up call for the students. So I did the wake up call, and I text the parents and said, your child is online. I also recorded our lessons. And so the parents were able to watch it via their cell phones, and they were able to watch it on YouTube, or, you know, and I sent out the link via our class dojo. And so parents were connected to the lessons, and they saw their children interacting. And so normally we will have parents come up to observe our classroom, but in this instance, since March, parents have been observing us every day.
Yeah.
So the ones that were at work were able to actually just log in and join in because they had the Zoom links and the Google Meet links as well. And so they could join into the class sessions. But to be that additional support, to let parents know that I am the teacher and you're the parent, and the support that I need from you is just to ensure that the students have an environment where they can log in, where that we can have that one-on-one, where the environment is conducive to learning. And if you do that, I'll teach, and I'll teach to the best of my ability, and your child will learn. And we had a successful school year over the summer and since March. Built connections. One of the most difficult and challenging things to do is to build connections with students via a monitor. But I did just like you did with us, Sheba. You let us introduce ourselves. We talked to one another prior to, and I did that every day with my students. We had a morning meeting. During our break time, we had a break dancing session where we were able to TikTok. and
Fourth grade.
My birthday was March the 25th, and so we had a Zoom celebration for my birthday and the other students' birthday as they were coming up. I wore my birthday tiara and had my little Debbie snack cake, and so we sung happy birthday and danced. And so we built relationships and connections through the screens, just as if we were in our traditional classroom.
So you just gave us and other teachers some great examples of how to make online learning more fun. The other question is about mental health during this time, right? So let's turn to Nikisha for that. How do we keep our kids mentally healthy during these times, and the parents too? I mean, you know, times are tough, and to know that we're in for more virtual learning, it just doesn't look good.
Yeah, no, I agree. I think that it's definitely important to have great teachers like Shantira, because, you know, I think the gift of being connected is so key. And with parenting, you know, we show up, but we're not always present because we're so preoccupied with everything else that's going on in our background, whether that's work pressure, performance pressure for the kids, just trying to keep everything leveled. And so, you know, I believe that it's important for us to, one, be flexible. I think radical acceptance is really key. Surrendering and knowing that you're not in control. I think that that's really important for kids to witness and for us to model that even though we're not in control, but we're able to still provide a sense of safety and security for you. And so I think we need to be mindful around how we talk, positive talk, instead of saying, you know, it's dangerous to go outside, we should say it's safer to stay inside. So small things like that to just help decrease some of the worries and anxieties with kids. We need to know our kids. We need to know what anxiety can look like when it manifests in kids, what depression looks like when it manifests in kids. You know, some kids, especially younger kids, when they're depressed, then they tend to complain of body aches because they can't really verbalize or put into words what it's feeling like to be depressed. So just being really in tune to when you see a shift behaviorally and emotionally with our kids. You know, we have to stay well so that we can parent. And so I think that it's really important for us to have free time and to relax around some of the rules. I do believe in structure. I think kids need a sense of structure because it provides a sense of safety. But I think that we need to also realize that things are not the way that they were. And it's okay to not be perfect, because I don't know if perfect even exists. And, you know, with social media and all the different blogs on what are you doing with your kids? What am I doing with my kids? You know, I think that there needs to be no judgment around certain decisions. Allow yourself to be who you are and know that your intentions are best for what's best for your family. And just taking it really easy on yourself, be kind to yourself. And I think we said this before, but just being okay to be okay.
Sharita, does this ring true for you? You're a working mom, your husband's working as well. I'm working. Does all of that ring true for you? Do you have days where you just, you know, you're being hard on yourself and you're trying to figure out ways to not be so hard on yourself?
Yeah, I've had to have a lot of woosah moments because at the same time, this was just recently tax season. So as you can imagine, I mean, I'm working 12+ hour days at the same time trying to juggle the schedule of a 5-year-old. I actually never did pull my child out of daycare, and she's been going to cheer camp, which they only allow 8 students. But what ends up happening is when she comes home, she wants to still be wired and talk. And I'm still sitting there trying to do taxes, that I've had a lot of times where I've had to like literally sit down and do a 5, 4, 3, 2, 1 to try to get myself mentally together, because it is quite a lot. You know, not only is my spouse, you know, he's TSA, he works at the airport, but he's also military. So a lot of times all of it does fall on me with 2 different schedules and with the hectic work schedule of my own self. So yeah, believe me, there's been a lot of woo-saw moments. There's been a lot of, you know, thinking of, am I moving in the correct way to make sure that I create a safety environment, not only for myself mental wise and self-care wise, but also for them as well. Because, you know, kids don't necessarily understand, especially a 5-year-old, you know, they understand the word COVID-19, but having to quarantine, having to stay inside, you know, you know, to, I think like the other day, I was like, we had to stay inside, and my 5-year-old was like, why? It's semi outside. I can see the sun.
How do you keep them excited about school? Like for me right now, I'm thinking August 17th is coming up soon. And it's not going to be that morning where they get up and put on their fresh new outfit for school and meet their friends, you know, at the bus stop and you know, in the hallway. So what are you doing to, what do you have in your mind to get them excited for school when the first day of school comes up, Sharita?
I can definitely agree. I am in tears this year because this would have been the first year that my youngest would have been, you know, entering in kindergarten. And so I remember the first day of kindergarten for my oldest. I will not be having that experience this year with her. So it's sort of, I know that one of my neighbors had us go on Etsy and be able to get the little chalkboard that has my first day of school, things I like. So we're still going to have that experience, and trying to get her adjusted to being on a computer for learning. But the good thing is at least she will be around other, you know, young individuals her age and her age range from that standpoint. To the other teachers' point of view, my daughter did do the summer school virtual learning over the summer. So we have gotten acclimated as far as the 16-year-old, what that looks like and what that entails. But yeah, even she was like, okay, we're not going school shopping. I'm like, you're going to be sitting in a room in front of a computer. I mean, you'll
Save your money, Mom, save it.
No one's going to really know that you have on a new outfit. So,
you know better than all of us here handling taxes. Save that money. Dr.
Yeah.
Dave, what's the plan for your household?
Yeah, you know, I think all around, you know, some really important messages for viewers that are going to listen to this. I just want to say for a second to Shantara, thank you so much. I think everybody in the country now is figuring out who the real front lines really are, okay? As people are scurrying about to try to figure out how we do what you do every day. So thank you. Here's what I'll say. I think that we should take heart as a different generation than our children, because children are connecting digitally. Remember, before all this whole thing, we were trying to restrict them from doing that. Get off of your cell phone, right? You know, why don't you call your friend? Why don't you go to the mall with your friend? They are already connecting that way. So some of it is us kind of projecting where we come from on their experience. But remember, this is what they know. And they knew it before COVID-19. They knew that I'm going to FaceTime with my friend or Zoom with my friend, or, you know, or text as we communicate. And there's not necessarily a lack of emotion or connectivity. It's just different than what you and I are used to. And we all have had some connections on a cell phone where, you know, whatever those connections might be. So I do want us to take heart, but I also want us to understand the more we teach children about this and bring them and enroll and engage them in this whole process, the better. If I say the words, stop, drop, and
Roll.
roll. You didn't say roll. I'm going to come check your pulse. Everybody knows stop, drop, and roll. And fires are no laughing matter. Fires can be deadly. If we start to teach children what this virus is, bring them the facts and tell them how important it is for us to let this, the process of vaccines and us getting through this die over before we start to communicate in the way that they were used to before this, we get engagement. Let me give you an example of my 6-year-old who, occasionally daddy will reach over and drink something out of her cup or use her fork to eat. And she stops and says, well, daddy, you can't eat off of my fork. Why was she thinking about it? Well, she was thinking about spreading COVID-19. Now, I didn't tell her don't share forks. She made that connection on her own about, not, I want to kiss her all the time, not kissing as much, not to. So they already know. She understands the importance of wearing a mask and to wear it properly. So she's got these little cloth masks and sometimes they slide down and she is on her own, pulling her mask up over her nose. I think as parents who have never had any situation like this before, we project some of what we think it would have been like to experience it. And if we continue to do that, what we say to our kids and what we display to our kids, as a therapist said, is so really important. Our words are powerful. What you do to your subconscious mind is powerful. So if you are turning this situation, as all of you have done, I'm looking at Black women who I know have come over any number of challenges. You approach this in the same way, that I'm going to put together in my own mental state that I'm going to get through this, that there is a way beyond this. And you pass that along to your kids, they do that, right? Kids don't do what we say, they do what we do. If you're freaking out, your kid is more likely to freak out. If you smoke, your kid's more likely to smoke, right? So same kind of thing. Here's what I'll say to the pods. I love, Sharita, that the pods are going to be as safe as possible. Frequent testing. If people go into these pods and they have quarantined themselves for 2 to 3 weeks before going into them, that the instructors and the parents and the homes are paying, strict attention to the things that we know, like cleaning surfaces, hands. There's some hand sanitizer news coming out that might, kind of freak you out about hand sanitizer, but soap and water at these homes, and then getting tested, and then have everybody in that pod commit to a way of comporting themselves that's going to say, I'm committed to this pod and to our family to be as safe as I can, to not go to the club or to the pool or to the vacation as badly as I want to, because my kid is most important. Let me just highlight one more thing before I stop. When we start to say things like only 0.1 or 0.2% of the kids that go back to school will die, we're talking about tens of thousands of kids. Now, name me one parent, mother or father, grandparent or otherwise, who would want to have their kid be in that 0.1%. All of that is utterly ridiculous. So this news that is coming out, it just drives you crazy as a parent. Let's commit to being as absolutely safe as we possibly can. And I think things like the pods are going to help us get that sanity that we're all looking for.
Yeah, we just have to find our people now. That's what I'm trying to figure out. Who should I pod her up with? And at 16 years old for my daughter, what does that pod look like? To me, they don't need a teacher standing in front of them or a tutor standing in front of them. I think it's more of a who's going to be there to keep them on schedule, keep them united. So I'm still trying to figure out the teenager pod and how that would look like. Shantara, what would be your advice for parents who perhaps can't find a pod and are working all the time and can't get their kids to a pod? Or even some of the parents, we had this story on about kids who have developmental disabilities. What advice would you have for those parents trying to navigate digital learning?
I would have the same advice, and that is trust your school, trust your teachers. We are prepared to educate your child. This past summer and even during the March, April, and May, I had a combination, heterogeneous group of students. I had gifted learners. I had DS learners. I had what you call students who need additional support. And in that grouping, I was still able to support the students in their differentiated learning. And again, if parents just just trust us, give us the means, or give your child the means by creating that environment that's conducive to learning. We will do the rest. But I would additionally say that the library system is a great support system that offers tutoring, especially here in Clayton County. I'm on the Library Services Board. And so we have tutoring services. You can also bring your child to do additional research and different things in our library system. And your neighbors, the students are already connected. I believe, like Dave said, that the parents, sometimes parents project their fears upon the children. Mm-hmm. But I will tell you, I watched the students this past summer, and they were connected to one another. They worked outside. I was calling roll, and students would say, oh, such and such won't be in today. They're absent. And I said, how do you know? You all just met. But they were connecting outside, and they were having their own Google Meet sessions without me after the lessons. And so they were working together collaboratively on projects. And as Dr. Dave said, I have a 7-year-old niece, and she already has her own YouTube channel. She does her own makeup tutorial. I asked her how savvy, and she does the TikTok challenges, and she uploads them, and she can change her outfits. And I'm not even sure how to do that yet very quickly in the TikTok video. So
learning is learning. I mean, doing a TikTok video, let's be real here, doing a TikTok video and a YouTube video is so different from learning at home. I mean, that age, I remember when my daughter was in elementary, early middle, I was there checking over her homework every night, every morning, getting her up early before I went to work to go over. It's very, very hands-on at that time. And to know that these parents don't have, that these kids don't have teachers in front of them showing them how to do things, it's a struggle for a lot of the kids, not just parents.
It is a struggle for the kids and for the parents. But as I was saying, if the students are able, the technology piece is the largest piece of, our GMAS is online. So teachers have been preparing for the online assessment that the state gives all throughout the school year. And so the students take that 3rd through 12th grade. And so the devices and the technology, is what I was saying, is not a hindrance to the students. And so give us an opportunity to do our small groups on the devices. Give us an opportunity to do that one-on-one connection. I had one-on-one sessions with students all the time, in addition to working in groups of 3 and 4. And so to alleviate parents' concerns, just allow teachers, trust us to be the professional and to ensure that we're giving your students a quality education.
I wish we all had teachers like you, Shantara. You sound like an excellent, caring teacher, and that you definitely take your work home. Your work is home now, but I can already tell you take your work home. Nikisha, do you want to close us out here and just let us know, we keep talking about this first day of school, right? And to keep the kids excited. From a mental health perspective, would you recommend that parents and kids get prepared to treat the first day of school like they were leaving to go to school?
Sure. I think that it's really important to normalize whatever this phase we're in as much as possible. And so I know, like, keeping rituals that you do as a family is really important. So if you normally get that picture on the first day of school, then do that, and then let them go and get back comfortable and get into their zone, because you want to remind them that we still have some sense of normality in this place of unexpected. I mean, just of the unknown. So I would say yes, let them get dressed, give them that new outfit. You haven't had to buy a whole semester of outfits, so go ahead and buy one, because I think kids need to be incentivized and they need to have something to look forward to. And so I would also say, there's a lot of kids that the actual environment of school has been a protective factor for them, and their environments are not always the safest. And so I would encourage schools to really ramp up on their ability to assess for any type of emotional inabilities, social and wellness types of competencies, so that we can connect through the screens, but also be aware of who our high-risk patients, not patients, high-risk students are. And so that way, you know, we're all hands on deck from a whole wellness standpoint as well, because it's very stressful. And there's a lot of environmental factors that can become barriers to kids when they're learning. So my last point would be, you know, be okay with modifying your expectations as we go into the school year. Be really kind to yourself, be kind and gentle to your kids, and know that they still can be faced with bullying and all types of things, even though it's online. And so we've seen that prior to COVID. It doesn't go away with COVID. So remember to be present and not just show up.
Yeah, a few of us here are well aware of the cyberbullying. We've dealt with that already over the last few months, right? Right, Sharita?
Yeah.
All right, thank you all for joining me today. I appreciate your time. Couldn't have a better panel than today. Thank you, guys.
Good luck, everybody.
Thank you for
Bye.
having
Great to
us.
see everybody.
Thank you.